Good afternoon, everyone. I'm reporter Ryan Hughes with WPTV, and we're having an important discussion today talking about the rise in coronavirus cases that we are seeing right here in Florida, and now the impact that we're seeing the virus is having on young children. All of this as school is set to start next week. To join me in answering many of your questions, I want to bring in Dr. Shannon Fox with Palm Beach Pediatrics. Dr. Fox, good afternoon. Thank you for joining us.
Hi, thank you for inviting me.
Anytime. So before we get into that discussion and before we start taking some questions, Governor Ron DeSantis today addressing the state regarding the rise in cases and what we're seeing right now regarding the pandemic. Let's take a listen.
There's no data to suggest this is any different in terms of severity on kids. I think kids are very low risk, and I think the cost of keeping them out of school would be catastrophic, and we're going to have the schools open. We need the kids getting the education, and I'm confident that things will go well. And I'm also, these things have cycles to them, so as school gets going, hopefully we'll be on the other side of the wave, and I think people feel a lot better about it that time. The hospital admissions have slowed. I don't think we've reached the peak yet, but I think we're going to settle in hopefully this week or next week. But in terms of shutting down, we're not shutting down. We're going to have schools open. We're protecting every Floridian's job in this state. We're protecting people's small businesses. These interventions have failed time and time again throughout this pandemic, not just in the United States, but abroad. They have not stopped the spread, and particularly with Delta, which is even more transmissible. If it didn't stop it before, it definitely ain't going to stop it now.
All right, so that was Governor Ron DeSantis speaking this morning and again this afternoon in Sarasota. And Dr. Fox, I want you to respond to this with your experience, more than 2 decades worth of experience being a pediatrician, to the governor saying that kids are low risk. We definitely saw that in the early days of the pandemic. Is that changing? What are you seeing now regarding children and the coronavirus?
So, this is our concern is a year ago when we were talking about coronavirus, we were not really seeing it in our patient population, which is unusual. We know for viruses, kids tend to, share viruses. And last summer, we really weren't seeing it. So with the start of school last year, it seemed reasonable to do just as our county school board did, Palm Beach County Schools, which I think did an excellent job in managing this a year ago. However, we are now entering a school year with a different variant that we are now seeing much more commonly be symptomatic in children. So when we began testing our patients in October, when we got tests for the office, and we only test children who we think may have coronavirus. So we were purposely doing that in October through the school year, making sure that we weren't seeing kids who were sick that we would then send back to school with coronavirus, being part of the community, trying to help, keep the spread down and do our part. And we were seeing very low positivity rates, even with symptomatic children, 2 to 5%. Last month in June, 2% with a lot of illness. I think everyone with kids knows that last month, all of a sudden in June, we were hit with, respiratory syncytial virus and another virus called Coxsackie that causes hand, foot, mouth disease. We saw a lot of illness last month, but we were still at 2% positivity for our patients that, again, presented with flu-like illness. We tested them, cough, congestion, fever, sore throat, vomiting, diarrhea, just to make sure that they didn't have coronavirus. And it was only 2%. Well, in the last 2 weeks, we've seen a huge surge. And that surge on any given day can be anywhere from 20 to 40% of those kids that we're seeing that are symptomatic, that we are testing, again, to know if they have coronavirus so that we know how to educate them and keep them home, to quarantine them. And so this is the concern, is we're heading into more of the unknown. We've had a lot of this evolving information over the last year and a half, and now we're here again, but it's evolving information with a week left until school starts. So, that's why I'm here today, is to answer questions and, try to help parents make the best decisions moving forward with their children.
Well, let's tackle some of those questions. We have one coming in from Samantha. Can you address children with underlying health issues? Talk about that a little bit for us. And if a child is, infected with the virus and they have health issues, what are you seeing?
So again, until the last 2 weeks, just as what Governor DeSantis mentioned, we were really seeing most of our children with mild symptoms. In the last 2 weeks, the symptoms have increased. The teenagers in particular seem to be much more flu-like, with high fevers, headaches, really pretty miserable with it. And that puts them at risk if they are children or teens with asthma, underlying heart problems, any type of immunodeficiency, that they're not going to respond to the virus as anyone who is healthy without any medical condition would respond to it with their own natural immunity. And so again, because we're seeing this change in presentation, my fear is that we may see more really sick kids with those underlying diseases.
So we know that children 12 and up are able to get the vaccine at this time. Deanna is saying, when are they going to come out with a vaccine for our younger children, those under the age of 12?
We hope by the end of the year. We have heard as soon as September, but more realistically, not until November or December. It takes longer to test children in that age group for vaccines. It takes longer in general to test any of the pediatric population because, again, there's different criteria that the clinical trials have to go through to be able to prove that they're safe and effective for children. And in particular for the younger kids, because of the dosing. So in our field, we dose medications based on it's the same concept, as we need to make sure that we'll be giving a effective, safe dose to children in that age group.
What about the age range that you are seeing with kids contracting COVID? Shell asking that question for us.
I had a 3-month-old last week that had it. Anywhere from, that, and we've actually had newborns that have tested positive for it right after delivery from positive moms. And then through the teen years, as I mentioned, it runs the whole spectrum of our birth to 21-year-old age groups.
And then are the children that tested positive, have their parents been vaccinated?
For the most part, that's always something we ask. We ask with any of our patients who come in with illness, and honestly, with even all of our well right now, which we're seeing a large number of well visits because school starts next week. We always ask about parents getting vaccine, as well as the children who are 12 and older. And a lot of parents have, said that they have not gotten the vaccine, and their 12 and older children have not gotten the vaccine. We have, as far as I know, for our practice, we have 3 offices, and there are 11 providers. We haven't had breakthrough cases within immediate family at this point that I have heard about. So most of these people that are positive have family that have either not been vaccinated and shared it with them, or the parents have been vaccinated and the child wasn't and got it from camp or daycare.
And then brought it back into the house.
Yes.
Okay. Stephanie has a really good question here. She says, since kids are getting this and it is a high transfer rate, what can parents do to protect themselves and other family members, especially since children cannot quarantine?
So that is an excellent question. And children, again, issue is the less than 12 cannot get a vaccine either. So this is where we all have to kind of band together as a community and, really try to help one another protect those children less than 12 until they are able to be vaccinated. And, we know that not all parents are going to want that, but until that option is available, then making sure that if you have a sick child at home, you're not sending them to camp or daycare. You're having them evaluated by your pediatrician to see if they potentially have coronavirus, because we know it is highly transmissible. And especially this variant over the last 2 weeks that we are seeing, that we are assuming is the Delta variant, that we are seeing kids now pass it, to each other. So keeping your kids home from daycare and from camp, and really even on weekends and times away, being, careful about how many other people you're interacting with. So limiting your the exposure that your children have to smaller groups of people, and the social distancing, the hand washing. I mean, all of those things I think are still important for us in the pediatric medicine field, because of this patient population that has no option yet to get the vaccine, which we know the vaccine is our way out of this eventually. But right now, as was predicted, that Delta variant seemed to be more contagious amongst children than what we had seen in the past year and a half. And we are seeing this in our offices. And so our prediction is that this is going to continue to be spread very quickly through the pediatric population. So again, keeping your family safe, keeping your children safe by limiting those exposures. And if your child is sick, keeping them home.
One question that I want to ask you that a viewer asked me before we got started is, are you finding the Delta variant is triggering different symptoms in children beyond the flu-like symptoms that we've seen? Are you seeing more gastrointestinal type of symptoms?
We've seen a mix of symptoms that we can't really predict when the patient says, the list of things that they have. We sometimes are surprised that their coronavirus test is positive, because we have seen some kids with more gastrointestinal vomiting and diarrhea than the cough, congestion, and sore throat. However, we know this is how viruses are, that we say this to families all the time, that, mom last week might have had a sore throat and a cough with any virus, and then this week the child has vomiting and diarrhea, and it's very possible the same virus, but it's presenting differently in different people. We know how a lot of viruses work, and coronavirus has a long list of possible symptoms that we can attribute to it. And unfortunately, again, the one we worry most about is the multi-system inflammatory syndrome that can happen, MIS-C standing for children. There's also an adult variant. So, we need to all take this seriously and really be able to come and see your doctor if you're having symptoms. If the fever is going on for more than 4 or 5 days, absolutely, that's a very important time to have your child checked.
And Dr. Fox, with school beginning next week, kids going back into the classroom, Jamie's asking a question that many parents have on their mind right now. Do you recommend that kids still wear a mask while in school?
So the American Academy of Pediatrics recommends that all children go back to school wearing masks, especially in areas where there are a lot of cases of coronavirus. And I think that's the caveat here, that we are in that area. We are in a hot spot. And so as pediatricians, we have urged the school board to recommend that all kids wear masks in school, especially the younger kids that, cannot be immunized, but even the older kids, because a lot of them still have not been immunized. We also recommend anyone 12 and older to get vaccinated before school starts, in preparation to go back, really to decrease that risk of this spreading like wildfire throughout the schools.
I know just talking to a lot of parents on different stories that have youngsters that are in that age range where they can be vaccinated, the 12 plus, the teenagers, say to me, they're hesitant because they feel the vaccine is experimental, that it was rushed too fast. What can you say to those parents that still have concerns regarding the vaccine and why maybe they should rethink with what we're seeing with the Delta variant?
I completely empathize with parents every day. I spend a lot of time talking about this very thing with parents. They have had a lot of great questions about the vaccine through the last, 6 months, 7 months that it's been available. And ultimately, I feel that we all take risks. There's that risk benefit option, that we all have to, for ourselves personally and for our families, decide on. And the risk of getting coronavirus, and maybe not the child getting it who might have mild symptoms, but giving it to a family member who could possibly die from it, is very high right now. And so the risk of the vaccine, after now over 340 million doses have been given, is very small. And that's that chance that I recommend. That's what I've done for myself. I was one of the first who got the vaccine in December. My 18-year-old was one of the first to get it because he actually works in my office. So when we were able to immunize our staff in January, he got it. I mean, I really have seen it as, what else are we going to do? We need to get control over this virus before it mutates again. This is the issue, is this is evolving. This is why I know it's hard to really understand this if you're not in the medical field, because you hear different things on the news or on social media. And it's hard for us because it is evolving, but we have to go with what we know. And at this point, we know this vaccine is safe. This vaccine is effective. There have been so many doses given that if there were a problem with the vaccine, we would know now 7 months into it, and we are not uncovering any of those problems.
Okay. Another question regarding school. Do you think we should keep kids home that have underlying problems?
School is so important. The mental health crisis, I could spend a whole nother half an hour with you talking about, because that is, my interest and specialty. And as I said, last year, I pushed for the kids to go back to school. I think Palm Beach County Schools did a phenomenal job. Teachers, wow. I mean, amazing what they did this past year with the dual, online and kids in the classroom. But really best for all kids to be back in the classroom setting. And, I think any of us pediatricians who watch this mental health crisis even unfold more. I mean, we already had an issue, but this past year, it has been just escalating, would agree that the kids need to be back in school, need to be as safely as possible back in school, which means wearing their masks, having vaccines if they can, teachers being vaccinated, hand washing protocols, trying to keep them as distanced as possible, but it's not going to be 6 feet or 3 feet, possibly even, because they're going to all be back in school. Children with higher risk medical problems, that really comes down to, that personal decision to talk to your doctor about, and, to really decide whether you feel the benefit of your child being in school from a mental health perspective outweighs the risk of your child with the underlying medical condition and possibly getting COVID. There are other options in our county. If your child is not going to go physically back to school, it just will not be what it was in this past year, at least at this point. And again, this is evolving, right? Like, we could be saying this today and then in a week it could look different. So, but our hope, and again, why I'm here today, is my hope is that more and more parents are considering immunizing their older children to decrease that overall community spread and to be able to try to finally get control over this virus so that we don't have school closures in 2 weeks from now when they all go back and all of a sudden we have outbreaks in schools, because that's also not going to be healthy for anybody.
What would you compare this to right now with what we're seeing with the Delta variant and the sharp rise in cases? You said that, one of your biggest fears is with kids heading back into the classroom next week. Have we been through something similar in years past, or is this completely uncharted territory?
Well, in 2009, the busiest month of my entire 20 plus year career was in September with swine flu, H1N1. We had a similar pattern of summertime illness that the kids went back to school, and then there was no masks, no social distancing, no vaccine at that point for H1N1. And we had a huge explosion of it in our community. And again, kids with that as well. That's why I became a pediatrician. Kids are resilient. Kids are awesome. They manage to fight off a lot of things with their strong little immune systems better than us adults. So again, kids got sick, but not as sick as some adults. And this is our concern, is that we take care of the family, that, that pediatric patient is my patient, but their mom and dad and grandma and grandpa and great aunt and uncle that live with them are all in the same family. So I saw this happen when we didn't have any precautions going into August, September of swine flu, just as all of the rest of us that were in the community saw this happen. And we know that this is more deadly. I mean, over 640,000 people have died from this in the year. That's more deadly than swine flu was. And so with this new variant, and we are seeing this uptick in patients locally who have the illness, going back to school is concerning.
So today, the U.S. Health and Human Services says that hospitalizations in Florida have hit an all-time high. To go with this question, how sick are the children you are seeing with COVID? Are some children being admitted into the hospital?
So this is, again, probably a better question for those who work in the hospitals. But I can tell you from friends who are pediatric intensive care doctors throughout the state that there, and pediatric emergency room doctors throughout the state, there has been an increase in their ICU admissions from COVID. MISC is our concern. That's where the inflammatory response affects all the organs, including the heart, and can be more of a long-term disorder. But even, the kids with underlying respiratory conditions who wind up getting very sick from this. So it's there. The potential is there. The potential is there. It's just, how are we going to now try to put the brakes on this as much as we can to be able to protect everyone in our community?
Dr. Fox, I know you're on your lunch break and you have to get going here in a couple of minutes. Give us some final thoughts with over the past 2 weeks. I think you said we went from a 2% positivity in your office in June. Now, depending on the day, we're 20 to 40%. Final thoughts regarding the
Final thoughts. Again, I understand parents' hesitation to get vaccinated themselves, and understand just as well their hesitation with getting their children vaccinated. But this is all we have to really combat this. And we have something that's amazing. We give vaccines every day. This is the best class of vaccines that we have seen for that effective rate, that how many people they are going to protect and keep healthy and safe if they are exposed to coronavirus. So our push has been definitely to get vaccinated. All family members get vaccinated. And going back to school next week, consider sending your children wearing masks. My teenager's in high school, he's been vaccinated. He will wear a mask because I think it's the right thing to do. When we are in a situation right now, again, this is not forever, hopefully, if we all do the right thing. But when we are in this situation right now, where we have such an increase in the pediatric caseloads, that we are living around it, so our vaccine, we're going to have some breakthrough cases. We know that. So wearing masks, everybody, even if you are vaccinated, I think is just the smart thing to do right now. And again, hopefully not forever. Hopefully this, runs its course quickly. Again, viruses are so unpredictable. We see this every single year with these different variants of viruses. RSV in June. Who would have ever guessed that as pediatricians? Never in my career have I seen that. So please just consider getting your family vaccinated and sending your child to school with a mask next week.
And then one final question that I have, we've heard the word seasonal over the past couple of days regarding the coronavirus and the spike that we're seeing. Do you see that being a possibility with cases maybe going down in the next couple of weeks, or are vaccinations our only way out of this?
I honestly think vaccinations are the only thing that we know, because we're studying, the long-term efficacy, and they're monitoring people's titers in response to the vaccines, which is also why if you've had coronavirus, we're still recommending that you get the vaccine, because this is what we can, from a scientific standpoint, continue to monitor, and maybe give a booster if we need to. Where the virus, we really can't do anything about it. It's going to do its thing. And as I said, this is what viruses do. And our fear is that we're going to develop some type of variant that is not responsive to the vaccines that we have. And then that's very concerning, very concerning.
Dr. Fox, I know you are extremely busy right now, so we appreciate you taking some time with us this afternoon to answer questions. And thank you for all you're doing.
Thank you for having me. And I hope that I was able to, convince some people to take this seriously and consider getting vaccinated. Thank you.